When you start seeing signs of autism, you may go into denial like I did many years ago. Maybe you've talked to family members who say things like, he's just a little late talking and he'll catch up, don't worry. Maybe you see red flags, but then think of all the other things your child can do well. And maybe you're concerned about pinning a label on your child. Denial is wasted time not getting your child the therapy that they need to reach their fullest potential. So today, I'm going to talk about denial. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, online course creator, and best-selling author of The Verbal Behavior Approach. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm sharing a small excerpt from a recent podcast episode with speech and language pathologist and autism mom, Deidra Darst. She talks about her struggle with denial and getting ABA services for her son. You are a speech and language pathologist, and then you had a personal fall into the autism world too. So can you tell us how long you've been in SLP, and then describe how you fell into the autism world?
So I've been in SLP now for 9 years, and I've always worked with kids on the spectrum. It should have been a sign. I think my very first client I ever had was on the spectrum. My first big girl job, I had a lot of kids on the spectrum. And then I had kids, and my younger son, Colin, he's now 5, and he was diagnosed with severe autism at 3.
Okay, and you have an older son too,
Mm-hmm.
and
Finley.
Mm-hmm. Finley, okay, and Finley is just a year older than Colin.
Finley is 12 months and 6 days older than Colin, so
Wow.
They're very close. Yeah, and Finley was a late talker. So I was concerned about that. And then Colin, well, I don't know if you want me to get into this yet, but he was hitting milestones. So I kept, I would check that off. Oh, that's okay. He's crawling. Good. And then as he got older, then I started to realize, language, speech. So yeah, I worried about both of my kids, I guess.
Yeah. So you have a lot of experience with kids that are slightly delayed with speech and kids on the spectrum. And there is a lot of variability, what's normal. And there's a lot of worry, especially today when the autism rate is about 1 in 50, as back 20 years ago when Lucas was diagnosed, the autism rate was about 1 in 500. So lots more kids on the spectrum and lots of worry. Mm-hmm. And my boys are 18 months apart, little less than 18 months apart. And that complicates things too, because you don't know if you're going nuts and just having 2 kids.
I saw things with Colin, hindsight being 2020. He was 6 months old, and that was the first appointment with the pediatrician that I said, there's something going on, because he was a happy baby, but he was a fussy baby. And, we realized there were some belly issues and things like that. But when he was about a year old, that's when I really started to notice he didn't have interest in toys. Just little things like that. But when I would say that to my family, they would say, you're crazy. You just know too much. Just don't worry. He's fine. My grandma actually said, there's nothing wrong with that baby. I love him. And I said, I love him too. That's why I'm concerned.
So at what point did you said you started to have concerns about autism, maybe when he was about 1. Mm-hmm. And then how long did it take for the doctors to take you seriously, did you wait in line for a diagnosis, or how did that work? Because a lot of people are waiting 9 months to 2 years for a diagnosis. And this is 3 years ago.
I was mentioning it at well visits. Actually, my best friend is an OT. So when Colin was about 15 months old, I asked her to do a developmental assessment, and everything was within normal limits except for language, which I knew that. And I thought, I'm not going to call in birth to 3 to do what I'm already doing. I will just do what I'm doing already and keep going. And I would see things, but I would talk myself out of it. Like I would say, well, but look how social he is. He doesn't have any sensory issues. And then I would say, but he doesn't always respond to his name. And it was this constant back and forth that I drove myself crazy. And when he was 2.5, almost 2.5, it was like a light bulb moment that, oh, he does have sensory issues. That's outside of anything I understand. So I called in birth to 3. When he was 2, I asked his doctor, I said, I have autism concerns. And the pediatrician said to me, if he can point, he's not autistic.
Oh, boy.
And a few other things. We don't see that pediatrician anymore. But
did he point back then? Did he point it too?
He would point, but it wasn't always consistent. He was always kind of a hit or miss, and even on screenings, I would answer sometimes to some of the questions. When he turned 3, I put him in music therapy and OT. And the music therapist was a friend of mine, and she recommended ABA. And I can't remember if I mentioned this on the other podcast, but I was not a fan of ABA. I didn't really know what it was, but I was pretty sure I didn't like it. And I was almost offended when she said, well, ABA. And I was like, ooh, no, we don't want that. No, thank you. And she said, if you go to this clinic, they're going to change your mind. So we went for a visit, and it was like angels sang and answered all of my prayers. It was just everything that I knew he needed. Doctors were saying, oh, autism, ABA. But I didn't necessarily get information on resources, where to go, how to get ABA. Because I work in the field, I knew how to find it. But I could see where other parents would feel completely lost.
Once you started ABA, then did you start to see progress then?
It was immediate. I mean, it was like magic. I told them, I said, I don't know what kind of magic wand you have, but it's amazing. I document everything, and I keep all of his little notes that we get every day. And I went back, and when he had just had about 25 hours of ABA, he was already a different kid. He had learned to wait. He could sit. It was just amazing the things that he could do. And when I read your book, that was also like a moment for me to really understand what ABA is. And it was all those things that I knew he needed. We had talked about this, but I had left my job when he was 3 because I knew he needed this one-on-one intensive intervention. And we could help him. I knew he was in there. He had potential and he could learn. We just had to get in there. And when I read your book, I'm like, oh my gosh, this is exactly what he needs. But yeah, he started out, he was getting about 2 hours of ABA a day. And even at just 2 hours, it was life-changing. So I was sold.
What are the main struggles that you see with parents of kids with autism?
I feel like pediatricians don't recommend testing. They don't recommend therapy. And people will go to their pediatrician and their doctors, and we love them, and we appreciate them and all those things. But they'll go to their doctor with a concern, and they'll say, well, don't worry about it. They'll talk when they're 3. They'll catch up. It's okay. Don't worry about it. And that's a complete disservice because they need that early intervention. And we see how important that is to get in there early. And like you said, you can still do things later, but if you can get in there early, you're going to affect so much more change. And I feel like if your doctor tells you, oh, don't worry about it, then people don't worry about it. And then they wait. And then they wait until they're 4 and they go into preschool. And then the teacher says, whoa, what's going on here? And we've waited till 4 to get anything.
What about for professionals? What do you think they are struggling the most with in the autism world?
Now that I have seen ABA and I have a pretty good grasp on it and I see how effective it is, I feel like we all, as professionals, SLPs, OTs, PTs, BCBAs, if we can all work together, how beneficial is that going to be? Because I know I can bring things to the table, language-based, if we can get teachers on board. I think if we can have everybody on the same page and working together, then that's just going to benefit the kids.
I hope you enjoyed this short snippet from the podcast. If you want more content, check out the podcast at marybarbera.com/podcast. Wherever you're watching this, I'd love it if you would leave me a comment, give me a thumbs up, share this video with others who may benefit. And for more information, you can attend a free online workshop at marybarbera.com/workshop. And I'll see you right here next week.